Hello everyone, this is Idyli from therapyforme.co.uk. Today I'm here with Roxy Keel, CBT therapist and specialist in the dental psychology service, to talk about dental anxiety and dental phobia. Hi Roxy, welcome.
Hi Idyli, thank you very much.
Thank you very
Nice
much
to
for
be here.
joining us. Um, before we start talking about the topic that you have that specialty in, would you like to tell us a little bit about your background?
Yes, of course. So the beginning of my clinical background was working in educational psychology. So supporting children with learning difficulties as an assistant. And then I became more interested in working in mental health with adults. And I've been working in forensic settings, supporting them as graduate mental health workers. Since then, I've also worked in IAP services and for various trauma services as well. And currently, I'm working in a dental psychology specialist service, and that takes me up to right now.
Brilliant. It sounds like a very long and interesting journey. You worked in different settings with people with different level of needs, isn't it? Very, very interesting. So when we were getting ready for this session today, for this talk, you were telling me about how there is dental anxiety and dental phobia, and there are some common aspects, but also differences between the two. So it might be useful for people who are listening to us now to start with that, to define a little bit more dental anxiety and dental phobia.
Yeah, absolutely. So dental anxiety and phobia both come under an anxiety umbrella. Often the way that a dental anxiety might develop is from past difficult experiences, for example, a difficult experience at the dentist, and that can lead to years of feeling anxious about going to the dentist. So feeling anxious about going to a dentist or a dental setting is actually really, really common. So a lot of us feel anxious, but we still go to the appointments, go for checkups regularly, go to our hygiene appointments and so forth. It doesn't stop us from doing anything, but we can feel anxiety. So it's very normal. But this becomes diagnosed as a phobia when we avoid such checkups or hygiene appointments or treatments for years. And this is when the anxiety develops into something we call more of a phobia. And we would define it as a phobia when it has an impact on an individual's life.
Okay. I see. So a lot of people might feel the anxiety, but actually a smaller number of people have an actual phobia where they avoid going to the dentist, and it has an impact on their lives. And I think you mentioned also that you work with a range of presentations and symptoms like needle phobia as well, or you mentioned gag reflex.
Yeah, absolutely. So when we work with dental phobia, there's a lot of different things involved that have contributed to that dental phobia. So we do work specifically with needle phobias, specifically again dental needle phobias, but more generally sometimes people have a more general phobia of needles. And we also work with gag reflex. So some people have a very particularly sensitive gag reflex, and this stops them from going to the dentist sometimes, because what happens is they might go to an appointment and feel like they're stopping treatment and getting criticized by a dentist, which can be particularly difficult, understandably, for a patient sitting in the chair, and for treatment to be stopped because they're particularly sensitive gag reflex. It's a completely natural thing to have a sensitive gag reflex, but actually what you can do is train that. So we can help with training you to become a bit more resilient when you're in the dental chair. So techniques that can help you stay there longer and get through treatment. But this comes hand in hand with anxiety. So we do a bit of work on both. So physiological training and working on the anxiety.
Oh, brilliant. It will be really interesting to hear a little bit more about that. But
Yeah.
it sounds really hopeful that we might have more control over our anxiety and even our gag reflex and how our body reacts to stress or dental treatments than we feel that we do. So based on your experience and the people that you see in therapy, what is the impact of this type of anxiety or phobia, as you said, on people's lives?
So the impact, obviously, from when I was describing a phobia, so often people are avoiding appointments generally. Some people might be avoiding dental hygiene, not everybody, but the impact
Mm,
is usually that people can be in pain for a really long amount of time, only accessing dental services when it's an absolute emergency,
mm,
and sometimes when it's too late, that they might have to have an extraction, and often then as a result, it sort of feeds back into that pattern of having unpleasant experiences at the dentist. Um,
mm,
Another thing is with dental hygiene specifically, developing gum disease. So that's important, and so that's where dental hygiene comes in, and that's something that we do talk about as well as CBT therapists. We also encourage your routine and keeping up with that to help have a less of an impact actually on your life.
mm. And what are some of the symptoms of gum disease?
So there's very mild gum disease, and that you initially would get, and that's the most common form. And actually, just to be clear, that is reversible.
Hmm.
Um, so that is reversible with really good hygiene. So it's nothing to be concerned about if you ever get told that. So the main symptoms are usually bleeding when brushing.
Mm.
Um, I think that's actually the main symptom. It's a dentist is the person who would actually diagnose it by having a look at your gums and
I see. Hmm.
using their professional expertise. Yeah.
Okay. Um, So, how important is it for us to look after our dental hygiene? It sounds like by doing it, we avoid the development of diseases like gum disease that can lead to other distressing symptoms like bleeding. You also mentioned pain, that if we don't look after ourselves and our dental hygiene, we can actually experience pain for a very long time.
Yeah, absolutely. And it's really important that we look after our teeth for that reason. And also, obviously, things like our heart health as well. That's another important thing to consider with dental hygiene. Actually, looking after your teeth, your mouth, and the bacteria in managing the bacteria in your mouth also affects other parts of our body. So it's important that we do look after that. But this is all I'm talking about long term.
So you mentioned before a very hopeful message that we can actually work on our difficult feelings, even the ways that our bodies respond when we go for treatment at the dentist. What are
Yes.
the steps that we can take to help ourselves overcome these difficult feelings, the anxiety and the phobia, using cognitive behavioral therapy, which is the model that you're a specialist in?
Yeah, of course. So the most important thing I would say, just from what I've described about phobia, so if you think you might have a dental phobia where you haven't been to the dentist for years and years, you've been avoiding it as your anxiety has built up, um, I would recommend seeing a professional.
Mhm.
So that would be going through your GP and explaining the presenting problem, and they will make a referral for you to either a specialist service or a local service who can support you. Um,
Mhm.
Cognitive behavioural therapy is an extremely effective therapy for managing dental phobia and dental anxiety, actually. So I highly recommend it. The things that we might work on, and some of the things that I'd say, if anyone out there has dental anxiety as well, that they could think about a little bit themselves if they didn't feel that they needed CBT, but that they wanted to work on this a little bit, would be we the way we'd start is to really understand the problem, because often someone's problem is developed from a past experience that's been particularly
Mm.
difficult. So that's step one, because every single person is completely different and individual. And it's important that the first when you first meet, that it's somewhere that's not a dental setting, somewhere that they feel really comfortable. And then after that, the things that we would say that are important are to make a list of the main sort of every single little element of the dentist. So everyone's got a different fear about the dentist. So it could be the dental chair, it could be the dental equipment, it could be the dentist themselves or dental health professionals. It could be being in that clinical setting. So it could be needles, like we were just saying. So we'd make a list from the lowest. We'd first make a list of all of the triggers for each patient. We do this together. Usually we use cards that we already have prepared, and then we just put them in an order from the lowest level anxiety to the highest level of anxiety. And together we'd start from the very bottom step. So this could just be looking at a photo of something like a dental chair, for example, and then working our way up to looking at a tool, for example. And I'll explain a bit more in a bit when I discuss an example of a case study, and maybe tell you a bit more detail then. But the main things are knowledge of dental tools and understanding what they do. And what we know is that knowledge is actually power. So the more you know about the setting, the more actually you feel in control, and actually the more manageable your anxiety feels. And we just give you a lot of information about how CBT works as well. So how exposure therapy works, and how important it is to habituate. So by habituate, I mean stay in the situation that makes you feel anxiety, and starting from something that feels very doable. And together we do this, and we build trust together before we even start doing a hierarchy. But that's the gist of how things would work. And so this is something that if you are experiencing a little bit of anxiety about something, you can just gradually work your way up in your own time if you don't feel that you've got a phobia of the dentist.
So it sounds like even if people are not in therapy or haven't started therapy yet, there are still steps that they can take to identify and understand a little bit better what they're afraid of, what they're anxious about, like making the list, as you said, of I'm saying that because we often see the visit to the dentist as one thing, but actually it's not. You made a really good and helpful point that there are aspects of the experience that people might struggle more with. So the first step might be for people, even if they're not in therapy yet, to write down exactly what they struggle with, and maybe put it into categories, starting from the easiest parts of the experience, the medium and the harder ones. And is that something that might help the therapist as well? If someone has already done this piece of work before they start treatment sessions, is it something that then might help you have some sense of direction in terms of the next step?
I mean, if someone feels able to do that, then absolutely that can be really helpful. But that's a big part of the work that we do together as well initially, and it's part of the building of the trust. So if someone finds that quite anxiety provoking to do, then equally it's okay not to. But for someone who's experiencing some mild dental anxiety, then yeah, absolutely, that's a really good idea. And it just helps to see things as well on a piece of paper in front of you. Okay, these are the steps that I'm going to be taking, and that will form the structure of the work that we'll be doing.
That sounds great. So it sounds like a therapeutic relationship and having someone to support you through this process and through this journey is really, really important. Yes. So it's something that people cannot do on their own if they try to read some information and go through the process of exposure themselves. And also you mentioned that knowing information about the tools, the equipment, the certain steps that the dentist might take during treatment, that's also really important.
Yes, absolutely. So a big part of a dental phobia is actually sort of a feeling of loss of control. So you don't feel like you've got much control when you're in that chair. It's all down to the professional, and that you must do your best to comply, and that you don't have any control. You can't leave when you want to, but actually it couldn't be further from the truth. So Actually, you have a lot of control and you can leave whenever you want. And these are things that we work on as well. Communication is extremely important with a dentist. So raising your hand up, the stop signal we introduce you to. We also work on speaking with the dentist, how you communicate, ask them to explain what they're going to be doing in therapy. And we also create something called a letter for a dentist. So it's just a piece of paper really that says in your own words what you'll be needing when you come to an appointment. So a dentist can be aware of that in advance. So that could be, for example, please let me have 5 minutes to just settle in the chair when I first come to an appointment. When I put my hand up, please can you stop straight away? Stuff like that. It's important.
And how do you find that dentists respond to that? Do you find that they're quite good at knowing what dental anxiety is, what dental phobia is?
Yeah, absolutely. So dentists will actually be more experienced than you think, because dental anxiety and dental phobia is extremely common. So it's actually one of the most common phobias. So dentists are very aware of it, and actually luckily that's now in part of the dental undergraduate's curriculum, communication and working with people. So it's actually something that they're really promoting now, because they're seeing that this is a problem when dentists are just getting on with the work and not really explaining what's going on to patients. And so I would hope that most dentists at the moment are actually doing that, and that's been my experience from working really closely with dentists. They've been really considerate. So I think that's really important.
Really good to hear.
Yeah.
Because I'm wondering whether, parts of the worry of people that you work with who suffer from this type of anxiety is actually how the dentist is going to respond to their assertiveness, to their requests to have some extra time. So it's really reassuring to hear that actually dentists are getting training on this. They know that people struggle with that very, very frequently, and chances are that they're going to react with respect and reassurance and giving people what they need.
Absolutely.
In terms of some of the... Sorry.
I was just going to say, and it's really important that people get this experience, because often people have an experience from years and years and years ago where they weren't listened to, and that certainly wasn't the case. And so it feels very difficult for them to trust that again. And that is something that someone like me would help bridge that gap of trust with. So that's important as well.
Absolutely. It sounds like this could be one challenge that people face in overcoming their anxiety and fears. So if they've had previous challenging or traumatic experiences, it might get in the way of them giving the experience another go, or trusting the dentist again as a professional. What are some of the challenges that you find that people face in trying to overcome their anxiety?
I think one of the biggest challenges, especially working in a specialist service where we are actually in a clinical hospital setting, is people initially feeling like they can't come to the appointment because they are actually facing their phobia just by coming and waiting in that waiting room. And so that's why it's really important that people know that these things are thought out, and we do have it in a normal room of an office for the first session, and we really do take our time before we'd ever think about moving on from that safety of that room for those patients. So that's one challenge actually that puts people off coming, but actually everyone's always pleasantly surprised when they actually do take that first initial step, at how doable it feels. I think other challenges are with CBT generally, and specifically with something like exposure therapy. You do need to be attending regularly, so the more regularly you attend, the more you benefit. So weekly attendance is ideal. That's incredible. You make progress really quickly, and if not fortnightly. And obviously people's jobs can get in the way, and another really important factor is mental health generally. So if someone's experiencing other types of anxiety, or depression or anything, other stresses in their life at the time, it can be quite difficult to engage with something that is already quite challenging, of course.
Absolutely, yeah.
So it's important it's the right time, and that is something that we discuss in the first session as well.
Mhm. So even getting to the first session, the first appointment can be really challenging, and finding enough time and resources to consistently engage in therapy. It sounds like, as CBT therapists, we know that therapy can be quite demanding in terms of people's energy, people's time, but that's the only way that it can be effective if they engage regularly in sessions and they try to make the most out of the time with a therapist.
Yeah, exactly. And I guess it is challenging, but I think if you feel open to a therapist, we can support you through that. So if you found a session difficult, rather than the easiest thing would be to just not come back or to avoid,
Yeah.
but from my experience, when people really open up to me and say, that was really difficult today, do you think next session we could just talk about that in the safety of your office, then we will just have a nice session working on that, and then people often feel confident to take the next step.
Absolutely, yeah. Openness and transparency are very important. Now, I know you work with both children and adults, so you have a range of experiences, and I'm wondering whether you would be happy to share. I know that for confidentiality reasons, you can share exactly a clinical case, but maybe a typical example or case of an adult and a child and how you would work with them.
Yeah, absolutely. So just a typical example of how I might work with an adult, just to begin with, would be we'd have, just like I've said, we'd have that initial session where and maybe sometimes it's more than one initial session, where we really spend some time getting to understand the problem, how long it's been a problem for, what their goals are, and so that's the first step with an adult, what we might do. I think then also making a plan. So firstly, psychoeducation is really important. So going through all of the things that are important to know about CBT and exposure therapy, and then we don't move on until we feel like we're really comfortable and knowledgeable about what we're going to be doing. And then we just create, like I was mentioning earlier, a ladder, so a hierarchy of situations from the lowest to the highest, and we just build up on that. So an example that I would say, like a typical example, would be starting with something like looking at a photo of a dental mirror, and then maybe photos of other dental tools. So we'd start with two sections, like a hygiene equipment. So there's 4 tools in that, and then the tools for the examination equipment as well. You'd be really surprised to know how few there are and how quickly they can become familiar with those. And then moving on from that, we might have a look at them. Anything we can look at in the safety of the room, that's always a good start, so where people are feeling comfortable. And then another step might be, for example, sitting in a dental waiting room. And these tasks we can give in between sessions as well. And then the next step might be walking down the corridor and just having a look. Maybe we might just look around and get used to the environment, and then we just keep following that hierarchy. And then eventually, when we're getting to someone feeling ready, which often they really do surprise themselves with how confident they can feel. And everyone's different, of course, with how long they take to get there. We'd move into the dental environment. So looking into a dental treatment room, just the two of us, sitting in a chair, seeing how that feels. It really depends what we're working on the hierarchy. Another example might be reclining the chair together, practicing some relaxation techniques together, distraction techniques, which are very useful for dental psychology specifically. And then we might introduce a hygienist who is specifically trained to work with with the dental psychology department. So we've got some lovely communication skills, and they will just help us to do any exposure that we want, basically. So for example, just a practice of opening the mouth and them looking in, and then that's it. And going through each and every step of this hierarchy, we're rating your anxiety out of 10, 10 meaning the highest, 0 the lowest, and we're watching it go down. So that's what, going back to the habituation, it's important that each patient sees that anxiety drop every time, and even if it's dropping by a tiny bit every time, we're on to a winner, and that is the case. So and then eventually what we're working towards is having a checkup or an examination, and a lot of people are usually using sedation, so because of the anxiety, to have treatment. So we're coming away from that, where it's not necessary to use sedation, and that's usually the end goal if there's any treatment that needs doing. Otherwise it's more something like a checkup and a hygiene appointment.
Okay. So it sounds like it's helpful if it's the whole process is broken down into smaller, manageable steps. And although it might feel as if it's going to take longer, it tends to be much more effective to break it down and take one small step at a time, and then build on the previous achievement.
Yeah, absolutely. Yeah, exactly that.
So that's quite reassuring, because people can actually accept that this is the most helpful approach, and they don't need to feel any rush to make big jumps or big steps from one situation to the next. It's helpful, and it's okay to go at a pace that feels comfortable for them.
Yeah, absolutely. And that's the most important thing to know, I think, because this is when people are coming to our service, it's a really big step for them. It's often something they've been contemplating for a while. And so building that trust just with myself in it alone is really important. And it's important people know they're not rushed and they're completely in control. We decide each step together.
Sure. So working with a child rather than an adult, does it feel similar? Is it going to be similar steps that you will be taking with a child?
Yeah, so we take the same approach, so exposure therapy, and of course starting with understanding the problem, psychoeducation, about anxiety, so really understanding the problem. But the main thing with children actually that we do work on, it tends to be, is actually toothbrushing. So often children can be quite avoidant of toothbrushing, to the point that they might have not have been doing it for years. This can become, for various reasons, it can become something that they avoid doing because it causes anxiety. Often, again, there can be a bad experience from the past with the toothbrushing, but also sometimes it just is become a habit. So we use exposure therapy this way. So, for example, we might start with just brushing with the finger alone, without toothpaste, and we might then put a flavourless toothpaste on the finger and start brushing the front teeth and build our way back, and then work up to a toothbrush. But again, it really depends on the individual child, because they all have different. So some people it might be the toothbrush that's causing the most anxiety, and some people it might be something more like the toothpaste. So just some things that we might focus on, and then after that, once we feel like their dental hygiene is they've really got that the hang of that, which can take some time, we might then start to address things in the environment that are making them feel anxious, which is again exactly like it is with adults.
I see. And you mentioned before, earlier in our discussion, the possibility of people having a gag reflex that's quite sensitive, and how it's actually possible for them to take that under control and to train themselves to be more resilient with that. So would you follow again a similar exposure therapy approach with that, with how the body reacts to triggers?
Yeah, absolutely. So what we do is, again, understand where the gag reflex is being triggered in the first place. Some people, it's just completely a physiological response, but it's stopping them from having treatment. However, some people, they've become quite anxious about the dentist, and those are more the people I work with as a result of the gag reflex. So we'd work on the gag reflex in a way that, for example, we'd find the trigger point. So it could be the back teeth, often that's quite common, or the palate of the mouth. And we would start with something like a toothbrush, because often that's quite difficult for people with a severe gag reflex, and just touching it for 1 second and taking it out. And then we learn where those points are, and then I'd set tasks for you to do in between session where you continue that process, maybe like while you're watching TV or something. And the body actually builds up a tolerance to it. So if you think about fire breathers, I'm sure you might have seen a fire breather in a circus or something. They often have to do a very similar thing. They train their gag reflex to be able to withstand that kind of thing, touching their throat.
So interesting. Okay. So I guess these are symptoms that we often can imagine that we can train ourselves to change how our body responds, but it's really reassuring and nice to hear that that's actually possible, and with practice we can achieve very good outcomes. It's brilliant.
Absolutely.
Is there anything else maybe that I haven't asked you about today, but it's still quite important to mention about the work that you do, or people with dental anxiety and phobia?
No, I don't think so. I think that if this feels like something that could be useful for anybody, I'd really recommend going to your GP and just asking for support with this, because GPs often are quite used to that, and that's what I'd recommend. But I don't think so. No, I think that's everything.
Okay. Great. It's extremely useful to hear a little bit more about this. Even therapists like myself, who don't have this expertise and who haven't had experiences specifically around dental anxiety and dental phobia with many people, I find it really useful to actually understand it better, to understand ways that you use to try and help people. And I'm sure that people who are listening to us, who might have experienced anxiety or even have a phobia around dental treatments and visiting the dentist, might already feel quite reassured to hear that there are treatments available. There are really good results that people achieve by using CBT and building that therapeutic relationship. So thank you very much for sharing your experiences, Roxy. It was extremely useful today for us.
Oh, it's been a pleasure. Thanks for inviting me.
You're welcome. All the best for the future. Take care.
Thank you. Take care.
Bye.
Bye.